Up first, though, speaking of wellness, Advanced ENT and Allergy joining us to talk all about sleep apnea and to share insights on sleep and allergy care. Joining me now is Mallory Swanson, nurse practitioner from Advanced ENT and Allergy. Welcome to Listens Live.
Thank you.
Of course. So today we are talking all about sleep apnea, sleeping, and how allergies affects and how the whole system inside your body affects how you're sleeping, which we all know when you're not getting enough sleep, it can affect your whole entire day. So the first thing that we want to talk about is CPAP. Which I know a lot of people use it, a lot of people are familiar, but can we just talk about sleep apnea as a whole for people who may be unfamiliar with what it is and how something like CPAP can help?
Right. So sleep apnea itself is when the airway is collapsing on us in some way, shape, or form. So ordinarily in the day-to-day, you go to take a breath and the air goes in and the air comes back out. But in sleep apnea, while you are lying flat, usually the airway closes off, and when you go to take that breath, the breath doesn't go anywhere, and they'll have long periods of time between breaths, and that can drop your oxygen level. And usually the people that come in to get it evaluated have some degree of snoring. What CPAP does is it blows air into your airway and helps prop that airway open so that when you go to take that breath, you're able to do so.
But I think what we want to talk about today especially is how maybe an oral appliance can be an alternative to something like that in ways that you guys can help. So what are some of those alternatives, and how can someone take advantage of visiting you guys over at Advanced ENT and Allergy?
Yeah, so some people, for whatever reason, struggle with CPAP, and that's usually when we start looking into alternative treatment options, because usually something is better than nothing at all. So if you're claustrophobic with a CPAP machine, if you feel like it's suffocating you with it on, we will evaluate and make sure that there aren't pressure changes that can be made, that there aren't mask changes that can be made. But when we're talking about alternative treatment options, another non-invasive option would be the oral appliance. And what that does is it supports your jaw forward so that when you go to take that breath, your tongue has not fallen back into your throat and closed you off. That is a little more effective for some mild and moderate sleep apneas, but there are some surgical options out there as well. Inspire is going to be one that people have maybe seen commercials about, which is like a pacemaker for your tongue, essentially. It functions similarly in the fact that we are pushing the tongue forward out of the way of the airway so that, again, when you take that breath, the air is able to go through.
I know this time of year especially, it gets hard for me. You can still kind of hear some of it in my voice today. I'm still getting over some of these allergies that I've had lately. It makes it really hard to sleep sometimes because I lay in bed at night, and if I'm not sitting straight up, I can just feel all that stuff start to drain down. Yeah. And I'm snoring, I'm waking up, whether from the snoring or my wife slapping me over because she can't sleep because of it. How would you know, like if your child or if your partner is snoring, how would you know if that's a sign of sleep apnea? And should they come to Advanced ENT and Allergy to try to figure that out?
It's never a bad idea to get snoring evaluated. Sometimes it's something as simple as being congested from allergies or having something viral like a cold or COVID. But other times it can be anatomical issues, so a deviated nasal septum that could sometimes improve with some surgery. But what we're looking for with sleep apnea specifically would be long periods of time between breaths, sounds that are like gasping or choking, and waking up feeling like you did not get good rest. Like you could sleep again for another 8 hours and the end product's the same, you still don't feel rested.
So let's say they do come to you, they determine that that's what it is. How would they know if that oral appliance therapy would be the path for them? Who's a good candidate for that? Adults, kids, everyone in between? Where does that fall?
So we mostly address adult sleep apnea. Now there are some people in the Louisville area that address pediatric sleep apnea. A lot of times with children specifically, we are there as like a surgical consult. Sometimes something like a tonsillectomy is enough to improve children's sleep apnea. So I can't speak a ton to that one, but as to adult sleep apnea, you know, if they do have something like sleep apnea, most of the time, by the time they get to us, they've already been on a CPAP machine. So we're talking about those fairly early along in the process. But if we are able to diagnose sleep apnea as the primary person diagnosing it, we can talk about treatment options. Again, the first line treatment, the one that is pretty much guaranteed to be an effective treatment form, is going to be CPAP. But again, something sometimes is better than nothing at all if they're not able to tolerate that. So mild and moderate sleep apneas tend to be a little bit better fitted for the oral appliance.
So just in your expertise and what you've seen and the families that you've worked with, what are those results? What does that look like after you are part of this process? If you do end up using these oral appliances and therapy in that regard, what are these results looking like? What are they seeing? Are they happy with what happens afterwards? Are they happy with having visited Advanced ENT and Allergy?
So everything's variable, nothing's perfect. So some people think CPAP's the best thing since sliced bread. Other people think their oral appliance is the best thing since sliced bread. I have seen it be successful. There are a few people that genuinely struggle with that form as well. Usually the main complaint I'm going to hear about an oral appliance, if I hear anything at all, is some TMJ, jaw-like pain, or some tooth tenderness, because we are using the teeth to support the jaw open while they're sleeping. So yeah.
It just sounds like at the end of the day, whatever the problem is, being able to come to someone with that level of expertise like you guys, who know what they're talking about, who deal with this stuff every day, that's just what they need to do. How important is it for you just to offer this expertise to people who don't deal with it every day like you guys do?
Yeah, it's always, again, a good idea to get snoring or poor sleep quality evaluated. It's not always sleep apnea. Sometimes it truly is just that turbulent airflow from the snoring, from congestion, kind of like you mentioned earlier. Sometimes it's the anatomical issues, but it really is important to get the sleep evaluated, because untreated sleep apnea for prolonged periods of time increases the risk of things like blood clots, heart attacks, and strokes. And we like people to live long, uninhabited lives. Yeah.
I think that's a pretty universal idea, and I think we could all get behind everybody living long, healthy lives. So Mallory, thank you so much for joining us today on Listens Live. AdvancedENTandAllergy.com. It's a long one, but you're gonna want to visit if you think you may be suffering from sleep apnea or really any kind of allergies. You guys have got it all. Again, really appreciate you joining us today on Listens Live.